We're now going to be looking at the acetabulofemoral joint, and as you know now, that joints are named according to the two bones on either side. So hip, or the acetabulofemoral, is from the acetabulum, or the socket, and the head of the femur as they come together. So the hip joint, or the acetabulofemoral, and I'll interchange those two terms now, as the range of motion is shown below. So it flexes, this being the front to remind you of the pelvis. It will flex about 130 degrees. There is some abduction, movement away from the outside in the frontal plane, and that will do that about 35 to 45 degrees. And then there's some rotation. The hip has the ability also to do rotation, a little bit more external than internal rotation, as you'll see in the chart. But that's the movements of the hip. It moves in three planes to remind you, so it has a lot of movement. Protecting the hip, as with all synovial joints, there are ligaments preventing too much movement from happening. And just to show you also, as I open up this, there is this deep bit of fibrocartilage here to remind you that's called the labrum, and that stabilizes or reinforces the joint. Incidentally, this is a common injury in yoga now, to tear the labrum. If it tears, it cannot heal on its own. It requires a surgery to actually put it back down. Small little tears most people can get away with, but large tears would probably require some surgery to put that, staple that back down. So that's the acetabulofemoral joint. It's a ball and socket joint. It has lots of range of motion, and it is prone to conditions such as osteoarthritis. Okay, on to the knee.